right, how are you doing? It is another beautiful Wednesday, and it's that time again on Wednesday here. We like to talk health nutrition right here, and today we want to talk about the kidneys and the bladder. And I was just having a conversation with Doc here. Sana wanaume, unajua hata sisi tunaweza pata UTI. Anyway, we'll tell you more about that. I want Doc to introduce yourself. Go ahead.
Good morning. My name is Dr. Laura Shiundu. Happy to be here. And yes, today we'll be talking about kidney and bladder health.
Right.
Yes.
So I know a lot of people have, well, there's a lot of information, I guess, about the kidney, but let's start with the bladder first. And most people, I think one of the most common, do I call it an ailment, is or infections is a UTI.
Yes.
Right. So first of all, what is it? How does it occur?
Okay. UTI is basically what we call the urinary tract infection. Yes.
Okay.
A very common thing. I think
Yes.
more with women. Yes, in 80% of the cases. So basically, when we're talking about UTI, it's an infection of the bladder and the kidney as well. Yeah.
Right.
And usually, most of the time, it's bacterial infection. Yes. Yeah. So
It's
that's
a bacterial
what.
infection.
Yes.
So is there? Because again, there's so many. Or rather, let me say, what are some of the myths that you know, that maybe you've heard around the way you can get a UTI?
Well, they seem to be blamed a lot on dirty toilets.
Right.
Yes.
Yes.
Especially when you have to share, in cases where you have to share your toilets. Of course, we've heard of it in issues in sexual health as well. Though there's a dimension that we may touch later on.
Right.
But yeah, those are the main myths we talk about. Yeah. Yes.
So when it comes to, let's start then with debunking some of them. So if it is there some level of truth to, you know, like when people are sharing toilets and they're afraid now to part of UTI, I hear it a lot.
Yeah.
Is there a correlation, or what is the actual truth there?
I don't want exactly to call it a correlation.
Okay.
I want to attribute mostly UTIs to personal hygiene.
Okay.
Yes, toilets may be shared. Yes, they may be a bit dirty, but rarely will you find a UTI by just sitting on that toilet. Probability is probably by the time you're running to the toilet, you've held your urine for like quite a long time. I know women keep saying they want to get the best toilet, so they hold urine for so long.
Right.
Yeah, so most of the time you've held your urine for very long, so you create a bed and a seeding for the bacteria to actually grow. Sometimes it's because of personal hygiene, just not cleaning up well. And you'll find it's very common in the younger girls, yeah? You tell a mother you have your 6-year-old has a UTI, and she's very shocked.
Right.
Yes, because they might not know how to clean up, especially when they go to school. Yeah, so they end up cleaning up from behind to front instead of front to behind.
Right.
So again, you want to have that conversation with them. Yes, and so that's basically what we're saying. It's more of an infection that is because of ascending back into the urinary tract.
Right.
Yeah, so with the hygiene having an issue, also dehydration playing a part, because we end up having very concentrated urine. Sometimes it actually allows the bacteria actually to seed in that urine as well. Yeah.
And so then the other thing is, so you talked about, so that's one. The other one, you say there is a little bit of a relation with it when it comes to like sexual activity. So can you spread, or how does it work?
Again, a disclaimer. I don't want you to start asking your husbands many questions, yeah? And say you know? Yeah, there is a point where it can be a cause of the UTI for the fact that there can be a bit of traveling of the bacteria from the closer areas, the urethral side and the anal side as well. And of course, now, since I've put hygiene on the table as well, there's also a case where multiple sexual partners, where you can actually spread the UTI to other women. So you're basically changing the environment of the area, the vaginal area. And then from the vaginal area, there's actually contamination from the urethral side. So that's how the UTI comes about, yeah? More often, it's more of a personal issue rather than your partner giving it to you. There are cases where that happens, but most of the time we still want to look at the individual first. Yes.
So always when it occurs, as the famous song by so says, tujiangalie. Start with ourselves first.
Yes, please.
Okay. All right. We have a question here. We have the question of the day that we want to invite you to ask some questions. And it says here, do you have any questions around kidney and bladder health? Doc is here so you can ask them. If you want some level of anonymity, you can always send us an SMS. We won't reveal your name. It is 22422. But of course, on social media, if you use the hashtag Daybreak, then we can see your handle. So it depends on how you want to ask a question, but we welcome all of them. Whether you want to be anonymous, it's okay. Send us an SMS. We would mention name and place. But if you want, it's always good also to find out where you're watching from, so you can leave your name and where you're watching. If you don't, you can go ahead and ask on 22422. That number again, 22422, and the hashtag on social media is Daybreak. Now, when it comes to UTIs and men, as well, do men, first of all, do men get UTIs? Is it a rare occurrence, and what would cause it?
Yes, men do get UTIs, very rarely.
Okay.
What will cause it? Most of the time, unfortunately for men, there's association with STIs as well. Yeah. There's occasions where it is just on its own. We have a UTI going on, again, because maybe of dehydration or holding urine again for long. Again, common in the young boys as well. You've had cases where boys have had to even have early circumcision as well, because just to assist in passing of urine. Yes, so it can occur. It is very rare, but it does occur. Okay. Yes.
And so what then would you say is, are there foods, how do we keep our bladder healthy? Are there foods, are there things we're supposed to do? Yeah.
Okay, high on the list, of course, we have water.
Okay.
Yes? Water, we know our body is 80% of water. We know, I think every doctor will keep talking about water and water. And sometimes patients keep asking us, why this water thing, yes? Remember, the kidney is there to actually just maintain the internal environment of the body. Yeah, so it is dependent on water. It helps with even balancing the water as well. So high on our list is water, because you want the kidneys to be able to remove the toxins that are in the kidneys, to be able to remove any bacteria that's seated. Because again, we said if it's just stagnant in the bladder, it will actually allow growth for bacteria as well. Right. So high on the list, we're talking about water. Yes. Definitely any foods that are antioxidants. So we are looking at fruits and vegetables are a plus. Okay. Remember, we have extremes of bladder issues such as bladder cancer as well. So definitely we are looking, can we just stay healthy? Right. Balanced diets, less processed foods, because we do know that some of the foods that we eat actually have what we call carcinogens that actually put us at risk of bladder cancer. But again, bladder cancer is not so common in Kenya as well as of now. Okay. Yes.
And so what about weight? Does it have does it play a factor in kidney and bladder health?
Yes. So we see a correlation between bladder issues, kidney issues with high blood pressure, with diabetes as well. So remember, anything that is we've said the kidney is maintaining our internal environment. So anything that will alter the kidney also alters blood pressure. One of the functions of the kidney is to maintain blood pressure. So again, remember, obesity is related with blood pressure. Yeah. So it gives you, puts you at a higher risk of getting blood pressure. So if you're obese, you're at risk of blood pressure, at risk of diabetes, definitely at risk of affecting the kidneys as well. Yeah, so you definitely want to be having at least an exercise regime or a routine where you're able to at least control the body weight as well. Right. Yes.
So then the other thing is, if when it comes to foods as well, normally people say, if you want to know if a food is what part of the body, some of them are shaped like that. So, for example, the kidney, they have the beans. So is this a true notion?
I will be very careful as I comment about that. Right. Yes. Personally, I would look at, definitely we have the kidney shaped, and definitely beans are part of healthy foods in our balanced diet. So I would not attribute it only to beans. I will still say there's a range of things we can eat that are good for the kidney. We have the beans, as we've talked about, especially the red beans. We have the bananas. They have good potassium as well. On the fruits, I need to add cranberry. You'll hear doctors sometimes telling, especially women, you can probably invest in cranberry juice. The fruit itself is not very common in Kenya. Also, it's very good for bladder health as well. So things such as even the good fats like avocado are good. yeah, for bladder health. So basically, we're going back to healthy nutrition.
Right.
Yeah, which basically affects every part of our body.
Right.
Yeah, in a positive way. Yes.
Way. All right. And so some of the, when it comes to the kidneys, I know most people will probably know about kidney stones. But what are some of the other kidney, let me call them diseases, that exist? That exist.
Maybe I can divide it between male and female.
Okay.
For the male, of course, we have talked about the UTI, which is most common. We also have something that we call cystitis.
Cystitis.
Which basically is infection of the bladder. So it has actually, it's almost like a complication sometimes of recurrent UTI. It may come on its own as well. So you'll find maybe you might need to treat it more aggressively than a UTI as well. Then you can have issues in older women where we have urinary incontinence, where actually with age, you know, the muscles become a bit lax. Okay. Yeah, so they're not able to hold urine very well. So you find maybe in the probably 60s, 70s, whereby they can't make it to the bathroom because they're unable to hold the urine. Yes. Then we also have issues in pregnancy. I need to touch that, very important. I mean, with pregnancy, remember, there's a bit of pressure on the bladder.
Right.
Yeah, so that actually you'll find pregnant women always running to the bathroom, yeah, because it actually puts pressure on the, so it's not really a problem, but it's something that we need to note as well when we're talking about women.
Right.
Yes. And then, of course, again, we have to remember the issues that we get with UTIs. If it's recurrent, also it's also good to consider STIs as well. It may not be the case, but for women also we need to consider that as well. Yes, so that I'll just touch on that for the women for now. They also do get kidney stones sometimes. Yeah, but not as common as well. Yes.
So before you move to the men, maybe you can tell us some of the symptoms of, say, cystitis.
Yes.
Cystitis, yes. What are some of the worrying symptoms when somebody now needs to come to you?
Okay, so I will still go back to starting with the symptoms of a UTI because they are more or less the same.
Right.
So basically, the most common thing they will tell you, we have pain when passing urine. There's a burning sensation, literally. Sometimes
when passing urine.
Yeah, when passing urine. Some people will tell you, I'm unable to pass urine completely, in that I go to the bathroom, I pass urine, a few minutes later, there's a frequency. So I need to go back again.
Right.
Yeah, and it's usually very minimal drops that pass at that point. Then sometimes you'll have lower back pain. You may have lower abdominal pain. So you'll notice at the doctor's office, they will examine your abdomen sometimes just to check for areas of tenderness on the lower part. There are also very random symptoms such as nausea. Just come continuous nausea or continuous headaches and dizziness. Yeah, so basically there you have to have a very high index of suspicion and just test a broad number of tests, yes? Right. Yeah, but the most significant will be the pain passing urine, the burning sensation, will be the lower back pain, the lower abdominal pain, yes. And some people will tell you also I have a burning sensation in the vaginal lining as well, yes.
All right, so that's when they would come to you now. When you say when you're doing the tests, what are, like when they come to hospital, what are they going to go through in terms of testing?
So in terms of testing, ideally we would want to do what we call a urinalysis. Okay. It's a very simple test. We take some urine in the lab. They test it for different things, bacteria, proteins, excessive in minerals and all that. Yes, and then should it be recurrent, they will request what we call a urine culture. Now, a urine culture will take about 3 days to grow because probably we've treated the UTI maybe 4 times in a row, for example.
This will be over what kind of period? We are looking at even a frequency, even every month you're in the hospital for a UTI. It would be good for us to check. There's also cases of where we treat a UTI this week. A week later, again, you come back with the symptoms. Yes. So, of course, we'll start with the basics. Should it keep persistent and we notice the abdominal pain is more excruciating, we will also request for blood ultrasounds as well. Yeah, a pelvic ultrasound. Yeah, where we're able to actually visualize and see. Then you're able to see if there's also inflammation around the bladder lining as well. Okay. Yes. Okay. Yes. All right. And so, how do you then treat it? After let's say you've done even the culture and you found out that there's the problem, what are some of the treatments for it? Okay, so there are times we will be able to treat what we call empirically.
The patient has presented with symptoms, and we must admit not every health facility in our country will have also access to continuous lab tests. Sometimes a patient will come with specific symptoms, and you're able to just treat with what we call broad spectrum antibiotic, which is able to cover a wide range of microbials that would cause these urinary tract infections. In the case where you're able to test, it's also good evidence. We really encourage evidence-based medicine in the cases where we are able to. That is when we'll now do the urinalysis and now find out the extent of the infection, where we can actually classify it, whether it is mild, moderate, or severe UTI, and then would treat again with the appropriate antibiotic. Again, we are looking at factors. If the patient is pregnant, we also have to consider the antibiotic.
Age, is age a factor?
Age is also a factor, because with older age, we also have issues with kidneys as well. Yeah, so even, remember that kidneys help us with removing toxins, and some of the components in the medication has to be excreted through urine, kidneys. So we, of course, we want to look at that as well. And then also palatability for children. Of course, syrups are better. Yeah, adults, of course, prefer the tablets. We also have to look at drug compliance. There are cases where the patient is already on so much medication. So you want to look at the shortest doses that are quite going to be effective in this case. Yes. So there's a number of things we look into. If it is a recurrence, again, probably we'll go high in the scale and use different antibiotics compared to someone who just has an acute infection as well. Yes.
All right. So those are some of the ones you had mentioned for the females. What about the males in terms of the diseases and the issues of the bladder and kidney? So for the men, again, we said they may have UTIs, which are very rare. They may have issues with the stones that actually travel, the kidney stones that actually travel through the penile shaft. So what are now that we're there, what are the kidney stones? How do they?
So this is, remember we talked about the bladder, the kidney actually helping with excretion of toxins and substances. Some of them are mineral-based. There are cases where there's accumulation of these minerals, and they actually calcify. Calcify basically forming like stones. That's what it means, yes? So they actually form stones. So some of them are small enough to pass just through the urine. There'll be no symptom at all. Some might be very large, whereby we would get symptoms such as severe pain. That doesn't, it's usually around the back, the lower back region. Yeah, what we call the flank pain. And sometimes you may see blood in urine as well. Yes.
Wow. All right. Okay. And so, of course, I guess when you see the blood, that is definitely, you have to go and get checked.
Yes.
So then how do you treat kidney stones?
So kidney stones, again, we might be lucky that it passes through the urine with no symptoms at all, as we said earlier. Then there's the cases where we'd have to give you some medication to help it break down and then pass in smaller particles. Worst case scenario, we would now refer you to a urologist, and surgical intervention would have to be done and actually remove them. But most of the time, you're able to give medication, they are broken down. Sometimes surgeons actually, when they do have to do these procedures, will go and break it in as well, so that it comes out in smaller particles. Yeah, so it's usually more of almost non-invasive surgery. You just want to go in and laparoscopically and do that and come out. So you're not cutting. Yeah. Yes.
So that's what I was going If there's one thing men are afraid of.
Surgeries.
Surgeries.
Yes.
And that would mean, so for that would mean like how many days would such a procedure take if that becomes the only option of how you can go in, break them and...
Again, I don't want to give an exact number of dates because it depends also on the size of the stones as well. Yes, and how long they would take to break down. Definitely, you'll keep going for sessions with the doctor for consultations where they'll keep examining you through ultrasound to see if they have cleared completely. Yeah, most of the time they'll just pass asymptomatically through the urine, and eventually when you go and get checked by ultrasound or the MRI or CT scans, you'll find actually everything cleared. Yes.
Then there's the, I know most people know, you've heard about you can live with one kidney and all of this. So how does that dynamic work? Because, you know, some people might be watching. I had a friend who was very scared. He wanted to help, but he was like, I'm not sure I can actually just have one kidney. So what are some of the, you know, first of all, yes, it's true. It's true, yes?
Yes.
Okay, all right. Just wanted to get that out of the way. But then how do you know, first of all, if you can help out, you can donate a kidney? Does it have to be a family member, a relative, a certain blood group? Yeah.
Okay. So first, allow me to take you back to also children, newborn babies.
Right.
There are some who are born with just one kidney to begin with. And normally, they are able to function normally. Yes. So, yes, we can live with one kidney to begin with, yes.
Okay. So, you can just be born with one kidney?
Yes. There's such cases, yes. Very rare, but they do happen.
Right.
Yes. So, as we grow older, of course, now with issues with the kidney issues, bladder issues, we are at risk of, if you get the recurrent infections or you keep having something, or you get something like acute kidney failure, yeah. Before, of course, they consider the transplant and donation and all that. Of course, by that time, your kidneys are not functioning optimally, ideally. Of course, the first time we want to try and do some dialysis. You've heard of the dialysis.
Yes.
Something that probably you'll do twice a week, because by that time, remember, the kidney was supposed to be helping us remove toxins. So in this case, it's not doing what it's supposed to be doing, and it's failing. Remember, with kidney issues, everything else starts shutting down as well. We have issues with the blood pressure. We are having issues with circulation of blood as well. So there's actually a number of issues going on here. So after a number of tests, the doctor may consider, let's start with dialysis. Yeah, dialysis there are people who've lived for years on dialysis. Of course, it's a very, it's heavy, whether on the cost, whether on the family, emotionally and mentally. It's actually heavy on the person having to do every week. I mean, it's going out of your routine, going for your dialysis. Yes.
What would be, sorry, what would be what's the procedure, like what happens?
For dialysis itself.
Yes.
So, of course, you need to book in a facility where there's space. Yeah, I know we've had challenges where in institutions where the line is so long. So the ideal would be that you get 2 sessions most of the people will end up doing 2 sessions. There are a number of tests done, by the way, so that we can determine how many sessions you need every week. Yeah, so you're waking up early that day, and if it's maybe our government hospitals, there's a line definitely, so you need to be there very early. Yes, and so that you can now be prepared for the dialysis. Yeah, so most of the time they've already put up something we call a port in you already. So they just attach to that opening, and basically it goes through, the blood is going through cleansing. Yeah, what we call hemodialysis. There's the cases where they put a tap for you on the abdominal area, and it keeps, every night it's able to do that and just remove the toxins. As you do that, of course, there are a number of tests you go through. There are a number of foods you can't eat before and after, because, again, sodium, chloride is very delicate. You don't want to have too much salt. You don't want to have less salt. You don't want to have excess water. So the whole team will work with you to make sure you're following nutrition very well. Yeah, so basically you're looking at about maybe 3-4 hours. Yeah, so twice a week. Yeah.
I get when it becomes intense, even just, the explanation.
Yeah, of course, there's some facilities offering now night dialysis. That's a plus. But again, it's very costly, just the whole procedure and everything. Yes. Yes, so from the part of now the dialysis, at some point, of course, that may fail. It doesn't always fail, but it may fail. And of course, the doctor starts thinking of what other ways can we help you. So that's when you may consider kidney transplants. Looking for a donor is a whole game again, because you might be relatives and you're not compatible. So sometimes you'll find it's from a very random person. Of course, we start with relatives because that's where the higher probability of getting a kidney that would match with you is. Yeah, should you not get, of course, friends will come for tests and everything. So once a donor is actually identified, you also have to be the right candidate in that you're following, I want to say, like, rules in a way, because you're put on certain nutrition. If you are taking alcohol, you can't be doing that anymore. Yeah, so you have to be a candidate that's going to be willing to actually, because someone is actually giving you a kidney, so you need to be able to take care of it as well. Yes.
And so what are what makes somebody compatible? Like, what are you looking at to make sure this person is compatible?
A lot of genetics will be done. Okay. So just to see how close the DNA is going to be to you. And so you're trying to look at compatibility in the blood. So a number of tests are done so that we know that it would match with you. And even when you do get a kidney, you're put on medication, actually for life. Yeah, so that you don't reject the kidney as well. And the person who donates actually is fine. Okay. Usually can live on that kidney. Right. And of course still has to take care of themselves, because remember you have one kidney. Yes. So you can't be doing risky behavior, binge drinking. You just have to be very careful as well. Balanced diet, exercise, and keeping yourself healthy. Yes.
All right. Well, we have some people who have written in some questions. We want to take them.
Yes.
And let's see. So this is Sharon from Muthiga, says, I have recurrent candidiasis. I don't know. I think, is that the way to pronounce it? Candidiasis. Can it be a sign of a kidney problem?
For recurrent candidiasis, we'd need to look at a number of factors. It may not be related to UTIs. It might also be STI related. Okay. But of course, we'd start with the beginning. Look at, of course, hygiene, I said, is very key. How we clean up even after using the bathroom. Going to the bathroom regularly. Also, the type of innerwear we wear can really affect. Yeah, because candidiasis basically is a fungal infection, which is opportunistic. It waits for the body's immunity to go just slightly down, then it starts to thrive. So we are looking at still hygiene, and we're looking at...
so what would be the best innerwear? Is it
innerwear? Cotton panties would be ideal for this. Okay. Yeah. For women, we are advised not to have to clean up with what we call douching, where people actually insert the cleaning agents a bit way up in the vaginal lining, and that, of course, clears the good flora, the good bacteria, basically, yeah? And that makes you susceptible to infections. And most of the time with candidiasis, you may get also bacterial infections co-infecting together. So basically, I would encourage anyone having recurrent candidiasis, first of all, to get treatment from a health facility, and just to look at all the other factors of hygiene. Even hydration is also good. Remember, water is a plus for everything.
Right.
Yes. Yeah, but I'm sure with the right medication, she should be able to get help, and they should stop recurring. That's
a whole, there's something you've touched on, that's a whole other debate again.
Yes.
People talking about what you should use to wash, all these creams and what that promise all things. But we'll talk about that one day.
Yes.
Let's take the next question. You didn't leave your name. It says, what's the cause of pyronies and plaque in UTI? How is it treated? I don't know if I pronounced that right. Pyronis and plaque.
Pyronies and plaque in UTI.
Yes.
Right? And how is it treated? Basically, this would be substances that form in the urine that give the urine a cloudy appearance. Basically, they just tell us something is going on and growing. Yes, probably bacterial as well. Again, if we do what we talked about, bladder health, hydrating well, making sure we are maintaining hygiene as well, eating the right foods, ideally that should be taken care of. Yes.
So when you talk about hydrating well, there are other theories as well, 8 glasses. There are people who these days walk around with, I normally call them fuel tanks, because they're so big.
Yes.
And then is hydration, is it like when you take water, juice, tea, is that a factor, or is there just like 8 glasses of pure water, for example?
My ideal recommendation would be plain water.
Okay.
Yes, whereby we are looking at about 2 to 3 liters of water a day. That's roughly estimated 8 glasses. Again, I know it depends on the size of the glass as well. Right. But I know in school they taught us the 8 glasses. So ideally it's the 2 liters. So I know those fuel tanks, most of them are 2-liter tanks. Yes. We hope they consume and finish them through the day. 5.
Some that even have bars that tell you almost there. You're almost making it.
So the ideal, I would say, is 2 liters of water a day, throughout the day. Of course, we're not sitting and wanting you to, down the whole amount of water. Right. You can spread it out through the day, and it's actually not much when you do that. So that's what I would say is as ideal. For maybe sports men or women who are into sports, probably will sweat more, may need more water. They can push to their 3 liters. Yeah. Okay. So it just depends. But ideally, we want to be sticking to 2 liters of water. Yes.
All right. So our next question here, we have, your name is Caleb, you're watching from Kisumu. Simply, which medication, I like to say medication instead of drugs, which medication or food constricts kidneys' normal function, which should be avoided for good health? Like, what should you avoid? He's talking about drugs. Okay, in this case, then maybe it is drugs.
Yeah.
Because there are other things as well. And food that kind of constrict the function of the kidney.
Okay, for the general, again, bladder health, ideally, if you're eating your balanced diet, you should be okay. Yeah? What you do want to avoid is processed foods. You want to avoid very overspiced foods as well. Yeah, because they can create a very acidic nature as well. So you don't want to just tax your kidneys to work, overdrive, yes? So I'm not saying spices are a problem, but we just take them in moderation as well. Other foods that may be an issue, it becomes an issue when you're having kidney disease. That's how now where the problem is actually. And so if you're taking, if your kidneys are already failing, you will be put in a very, very bland, almost bland diet, where your potassium shouldn't be too high, calcium shouldn't be too low, So you'll find maybe you can't overdo maybe like bananas, you can't overdo some citric fruits, yeah. So they'll give you a moderation. That's when it becomes very crucial. The other things that you shouldn't take in that can be a problem, of course, excessive medication over the counter. I know we do a lot of over the counter medication, yes, especially on pain medication, yeah, which we highly discourage because sometimes we end up overdosing. Yeah, because any small thing you take a painkiller, anything small you're taking a painkiller, yeah. So you're actually overloading your body, and sometimes it doesn't need that medication. There's also people buying antibiotics over the counter. Yeah, I remember when now COVID was happening, everyone was buying the azithromycin continuously. That wasn't healthy for us, definitely, yes. So again, those are the drugs. If you overdo, I say we only take medication when there's a need. If you fail, every time you feel something small and you run to the chemist or pharmacy and you get something, that becomes an issue, a bit of a burden on your kidney and liver in the long run as well. Yes. So
everything in moderation. What about the famous stressed Kenyan remedy, alcohol?
Wow, alcohol has a lot of problems.
Right.
I don't know if it increases our stress or reduces. I believe it increases, yes. Yeah? Because remember, we are worried about anything altering the function of the kidneys. Okay. So definitely, if we're doing alcohol, it's a drug, right? So it's an extra toxin for the kidney to be removing. Yeah. So I would say there are other ways of relieving stress. Yeah. There's exercise. There's talking to someone. Right. Yeah. Right. So I would not advocate for that because it just causes you an unnecessary burden. And even after drinking, the next day you have more problems, I think.
The drink puts a pause on the problem.
Yes, yeah. The problems are there, and then you get dehydrated. It's just a mess the next day. The hangovers also is dehydration because your kidneys don't have enough water to function. So you're having to take excessive water to just come back to a normal, stable state. Right. Yes.
All right. So we have another question here. Let's take it. You didn't give a name. You say, what's the difference between kidney stones and gallbladder stones?
Okay, just by the name itself, the kidneys, the gallbladder is associated with the liver. Yes, so that would be stones through the gallbladder associated with the liver. The kidney literally is at the kidney. Yes, it's just a difference of location as well. Yes.
All right. So the next question. This is someone says, kindly differentiate between fungal infection and UTI. What can I do? I'm a man of 50. I have recurring infection in the kidneys. I find, all right, I'm going to have to kind of come close to this one. I can't quite see it. I'm a man of 50. I have recurring infection up to the kidneys. I find it's responding to antifungal than antibiotics. Can it really have a cure? So it says differentiate between fungal infections and UTI. He's 50 years old, and he has a recurring infection that responds more to antifungals than antibiotics.
At this point, I hope he has been seeking help.
Right.
Yes, I hope he's been seeing a healthcare provider, personnel, so that we can actually get the right medication.
Okay.
Most of the time, with the right tests, we should get the right medication. Remember, a urinary tract infection is a broad terminology for infection.
Okay.
Most of the time it is bacterial, but can also be fungal. Yeah, and they can also be the two of them together, what we call a co-infection.
Right.
Yes. So I would advise him to actually go for tests, proper tests. We find out where is there recurrence, because again, we said it's not common in men. So we want to find out, are there other issues? For men, especially at his age, I would also recommend we check prostate levels.
Okay.
Yeah, because it's one of the things that can cause some constriction when you're passing urine. So it makes you prone to getting bacteria and also fungal infections. We also need to look at STIs as well. Yes. So I would say let's just get a full examination done so that we can actually come to the bottom of this and find out what's going on.
Right.
Yes.
All right. Okay. Hopefully you go to get actual treatment. Let's listen to, or rather hear from Alan from Vega. Says, what are the symptoms of kidney failure?
Wow, kidney failure, that's an extreme. Eh?
Yeah.
Yeah, so kidney failure is one of the extremes you don't want to get to.
Okay.
Yeah, and it can be acute where it is just for maybe a short duration, of sudden onset. It could be because there's an underlying condition. Maybe you've been unwell, maybe you're admitted. I know, like during COVID, there are people who got a bit of acute kidney injuries, which have been reversed since then. Okay. So when it's acute, the probability is with very fast treatment and fast care, we should be able to reverse it. Yeah, before it becomes extreme. Yeah. So some of the symptoms would be, by that time, usually a patient is admitted most of the time.
Right.
Yeah,
right.
Most of the time. Because the kidneys start to shut. So you'll find in a day, you might not pass urine as much. You go and it's just small drops of urine and that's it. So basically what's happening, it's accumulating in the kidneys. Yeah. So you'll find a patient starts to look a bit puffy, and an abnormal swelling of the face, the feet. They just look really puffy. That's not, it's not weight gain. It's just puffiness, yes? And actually, it's what we call edema. Literally, if you touch it, almost like bounces off you, right? So there's that. There'll be a lot of tiredness, fatigue, a bit of confusion as well. Remember, now we are retaining all the toxins. Yeah, and with toxins in the body, your body starts, also your brain doesn't function as well. Yeah, so there might be a bit of confusion. And just a form of lethargy and malaise that's not, you will literally say this patient looks unwell. Yeah? Yes.
All right. Sorry. I'll take a look at another question here. Is it possible for one male to have a UTI after sleeping with someone and the person doesn't have the infection? Interesting question.
Wow. Again, we do not want battles at home.
Right.
But, we'll be very careful as we answer that.
Yes.
Again, there's some cases where men would get what we call urethritis.
Urethritis.
Yeah, which is just, basically it's because their urethra is, as I said, along the penile shaft, is a bit longer. They can get a bit of inflammation. So it may be an infection. Yeah. Most of the time, again, I would still say we have to check out for STIs for men, because again, we say it's not common in men. Yeah. So we'll look at both. We'll still do a urinalysis, still check out for any STIs as well. Yeah. And then also look now at, are there also kidney stones? Are there small stones passing through the urethral shaft causing an infection as well? Yeah.
Urethritis. So this, how would one know they have it? Is it, what kind of test would be done? The same urine analysis?
Urine test. First of all, the symptoms would be excessive pain when passing urine.
Okay.
And I know men don't do well with pain. Eh? Yeah, I'm not being biased though.
No, it is true.
I know they don't like coming to hospital, but when there's pain passing urine, they will indeed come.
Yes.
And it is pain that you cannot bear most of the time. Okay. So you will come to the healthcare facility, and you will be able to do a test. Yeah, should we check that and it's clean and the pain is still there, we'll still send you for an ultrasound as well, to confirm what's happening along the penile shaft and what's happening also still in the bladder as well.
Right.
Yes.
All right, we have another question here. You say, how many times on average should a man pass urine per day? How about women? I'm asking this because some literature argue that a high frequency of passing urine is an indicator of prostate cancer development.
Okay. Again, yes, I don't want to give you an exact number of the times you should go to the bathroom, but when it is abnormal, as an individual, you would know. Because there's a time, you know yourself, I know myself, that you will just regularly grow. When it becomes very frequent, actually to be a point of concern, you'll be like, I'm always going to the toilet, right? So that should make you get checked, because it could be, yes, a urinary tract infection seeding. For the men, as they grow older, again, they're at risk of prostate cancer. So again, just do what we call, we actually, with the health facility where we work, we really talk about prevention care, where we talk about annual screening, so that we're able to actually find out what's actually going on. Yes. So if it's prostate issues, let us catch it early and be able to help the individual as well.
That is one There's one test. I don't know if they've changed it, how they do it. But remember, there's a time we were a group of us that we had to encourage each other. We're about 6 to lijipeleka hospitali sisi wote at once for moral support to go for the prostate exam. I hope they've changed the way they do it. But anyway.
Well, the exam, the test is non-invasive. The test is a blood test, so that's a good thing.
That's a good thing.
The examination, though, I know can be interesting because it's an annual exam. Yeah, but again, it goes with age. As you grow older, it actually might be what saves you. I know it's uncomfortable, but we just do it.
And it's one.
Yes,
it's like it's annually, I guess.
It's annual, yes.
All right.
Yes.
Okay. So listen, men, tuende to angariwe as you grow older. Let's take a look at another question here. It says, I feel like I'm in medical class listening to my own student. I can't even ask a question. I will drink much water. Amesema amekusalimia, anaitwa Vulimu. Yes.
Yes, she was my primary school teacher.
Okay. All right. So, amesema shout out to you. Be Vulimu. So she taught you.
Yes, she did.
No, it's very good to see how far. And shout out to all teachers, by the way. Munatengeneza inchi. Shout out to you.
Thank you.
Right. So just as we wrap it up, of course. What are some other pointers? Most people have you seen there. There's a bit of you've emphasized a lot on also getting checked for STIs and all this, and you've emphasized on drinking water. Vile mwalimu amesema hapo tukunywe maji sana. There is also another question about people and all these diets and fat diets. They talk about detoxing. So now that you've said, the kidney is able to kind of do that for you.
Yes.
There are people who, and when somebody was mentioning about frequent urination, there are these times when people say, me, I'm juicing. For the next 3 days, I'm juicing. And then there's frequent. So are some of those things helpful, or should we just tuache tu kidney ifanye mambo yake? What's the position?
Again, I will talk very carefully.
Yes.
Ideally, the way our body is created by God is ideally it should be able to detox on its own.
Okay.
So how we help it is by eating the right foods. Yes, we've talked about the balanced diet, taking enough water. By you just doing that daily, that's enough detox.
Okay.
Yeah. The danger with our society, and I talk from also my experience, I am not, we're not accusing others. I talk from, I'm speaking to myself as well.
Right.
We do many years of taking in the wrong things. Yes. We end up getting unnecessary weight increase because of what we've eaten. Yeah. We end up... maybe what we said, the Kenyan drugs, sometimes people have overdone it.
Right.
Yes.
Right.
So all these things, at some point, your body complains because it's the way your body is wired. It is supposed to function in a certain way. It's supposed to heal itself. But now because of what has changed, of course, even the environment has a role to play, and a lot of the foods we eat as well. But if you did your water every day, took your balanced food every day, you shouldn't have to go into a crazy diet. And if you did exercise every day as a lifestyle, so don't wake up and decide, I want to lose this amount, I'm going to not eat anything. What ends up, you end up having people coming to see you at the healthcare facility. Because you've not been eating, so some are very weak, they're irritable, some have been brought in, they've collapsed, they're very dizzy, they keep losing consciousness. You will come and be told you're dehydrated. yes, you have to start, and you think you're very sick, but it's just what you're taking at that point. Yeah, so in the long run, I think you overstress the body when you do sudden regimes. So how about we do it every day?
Right.
Yes.
Just as part of a natural kind of progression.
Yes.
All right. And so, of course, the next question I will be asked a lot after this is how people can get in touch with you. So how can they get in touch with you? If you have a clinic, where is it based? A hospital you're frequent, and also social media.
So I work with AAR Healthcare, and the health center manager at the Lavington Outpatient Center. So that is where I am found. And my contacts, yes, can be shared. I don't have a problem with that. And yeah, we look forward to walking this journey of health together. Yes.
Right, and on social media, can they find you on
social media? Well, not on Twitter, but I'm LinkedIn. Yes, you'll find me there. Yeah, very conservative.
Yes. Let me tell you what, you're not missing much. You're actually, I'm slowly progressing towards that.
Yeah, so I just do LinkedIn. I use my phone number. As effectively as possible. Yeah, so I'm open up to phone calls. Yeah, and just to be able to assist where I can.
All right. So do you want to share your number, or do they reach out to us later on? Which one works for you? Because remember this, you might share it.
I think they can reach out to you. Yeah, but on LinkedIn, you'll always find me, definitely, with the same name, Dr. Laura Shiundu. Yes.
All right, awesome. And at AR Lavington.
AR Lavington.
AR Lavington.
Yeah, on Westfield Mall, Itanga Road.
All right, okay. Well, thank you so much for coming in and also for answering some of the questions. Again, there were so many others, but she said you can find at AR Lavington. You can reach out to me. And we link you that way. At women touch to me a filter. Only serious candidates.
Yes. Thank you.
But we hope that you've learned a thing or two or three. Bottom line, from what I picked, tufanye tu kile kitu tunafaa kufanya, tukunywe maji, which is very hard, by the way. If you, it's not so easy, but you know, wake up. Is it okay to? I see people put lemons, cucumber, just to kind of aid the taste.
That's fine.
That's okay.
Whatever works for you. Drink water. Just don't drink a flask of tea and tell me you drank water. Yes?
Yes.
So whatever works for you. Of course, don't overdo the lemon. Sometimes it can give you a bit of excessive acidity. Yeah. Just in moderation should be okay.
Right. Everything in moderation.
Yes.
All right. Now watu wa kudetox. Acha tuachie hapo. Thank you so much. Thank you so much
for
you
as well.
Watching, and thank you so much for coming.
Thank you.
And so after this, we're going to have a small, if you missed the interesting conversation that Trevor was having early on in the morning, we're going to have a repeat of that. And then after that, Seven a Citizen will continue on this. That will run all the way up to 2 on this very busy, I think, thank you, it's right there. It is 33 days to when you will exercise your right to vote, whether it will be Wahiga or Wajakoya or Hustler or Asimio, it's all up to you. So think about it, but in the meantime, you have to be healthy enough to get there. So always think about your health as well. Successful people look like you, and God loves you, and that will never change. We'll see you again tomorrow. Peace and love.